And a full report by NTV's Eunice Omolo coming up shortly. But the medical malpractice witnessed at the Kenyatta National Hospital has raised questions about the pre-surgery procedures in Kenyan hospitals generally, especially on how to ensure the right patient is operated on the right place. Now, it also calls to question doctors' lack of commitment to their patients to ensure that they receive the care they need to get well. Well, how did the neurosurgeon, the ward nurse, the theater receiving nurse, and the anaesthetist, who are all now suspended, get it this wrong? Well, let's take a look at the standards of practice for patient identification, correct surgery site, and the correct surgical procedure in the United States. For instance, well, the patient should have at least 2 corroborating patient identifiers as evidence to confirm identity. These include the patient's name, a signed identification number from the hospital, a telephone number, the date of birth, the address, and photograph. Now, all patients undergoing a surgical procedure should also wear an identifying marker. These markers can be a wristband as identification bracelet, a wristband with a unique bar-coded patient identifier, or a radio frequency identification marker, also known as a RFID. Now, also, all patients must be properly identified by the surgical team members prior to transporting the patient to the surgery department. The times of this verification of the patient identity and surgical procedure should happen: 1, when the surgery is scheduled; 2, when the patient is admitted to the healthcare facility, or anytime the patient is transferred to another caregiver, or prior to sedation, and lastly, prior to the patient's entry into the operating room. Now, when it comes to verifying the correct surgical procedure and site, this is the responsibility of the surgical team members. The methods used for proper confirmation of the surgical procedure and surgical site identification, should include, but are not limited to, the following: 1, the oral confirmation from the patient, the patient identification marker, the surgery schedule, and the patient chart that has all of their health details. Lastly, prior to the start of any surgical procedure, a timeout should be completed to verify the correct patient, correct surgical procedure, and correct surgical site. This happens in the pre-operative holding area, where the surgical team members should ask the patient to state, not confirm, the following: their name, date of birth, the correct procedure, site of surgical procedure, and the patient's responses should be reconciled against the marked site, the patient's hospital identification wristband, and informed consent. So some of those guidelines are what at least guide the surgical procedures in the U.S. Now, though both patients affected in this incident were in good condition, the reasons behind what could have led to this mishap need to be unearthed to restore some form of faith in the largest referral hospital in the region.